Dumelang, welcome to Face the Nation. My name is Clement Manyatela. Great to have you with us here on SABC News. On the show tonight, we are going to focus on this tragedy that has befallen the Eastern Cape. The Minister of Cooperative Governance and Traditional Affairs, Velenkosini Hlabisa, confirming this evening that the death toll has risen to 78. There are questions now about whether or not the classification of the state of disaster is sufficient to respond to this crisis. We'll speak to Dr. Elias Sithole this evening, who's the head of the National Disaster Management Center in the country. Also on the show, we are going to speak about our soldiers that are coming back home. Remember, they were deployed as part of the SAMI DRC, part of that peacekeeping mission in the DRC. They're coming back home. The first batch will be arriving tomorrow. We're going to be speaking to someone in the SANDF who will tell us about how that process will be unfolding as of tomorrow. And then later on, we're going to speak to the Minister of Health, Dr. Aaron Motsoaledi, about that new COVID-19 variant, but also other issues around the legalities or the legal court cases around the NHI as well. All of that coming up here on Face the Nation. But first, my comment. So tragedy has struck the Eastern Cape. The devastating floods in the province have claimed more than, now we're told, 78 lives. This is one of the painful tragedies to hit the province in recent years. Our thoughts and prayers are with the families and communities that have been affected. Emergency response teams have been dispatched to various areas and are working around the clock to provide critical support to communities that have been impacted. Infrastructure has been damaged. There are lives that have been lost, families have been displaced, and many are still worried about the whereabouts of their loved ones. Here's the Premier of the province, Oscar Mabuyane.
Within the OR Tambo District Municipality, where torrential rains over the recent days have caused devastating landslide and flooding, leaving hundreds of families displaced, as well as significant damage on critical infrastructure. When we learned of the extent of the devastation visited by adverse weather here and understood the magnitude of what has transpired, as a Premier, I immediately called for the suspension of other government programs in the province so that all members of the Executive Council, as you can observe, are all here to be able to provide the first-hand support and be able to be with our people on the ground.
Schooling has also been affected. More than 6,000 learners, we've been told, have been impacted by the devastating storm that hit the province. We're told up to this point, at least 58 schools have been damaged. The Minister of Education, Siviwe Kwahube, is also on the ground to ensure their contingency measures, especially for matriculants who are busy with their exams.
We know that over 70 schools in the province have been affected by the storm, and we also know that exams, particularly June exams, have also been affected by the storm over this past week. However, contingency plans have been made to make sure that the exams that have been missed or may have been missed this week will be rewritten at the end of June. And we will make sure that the DBE works very much hand in glove with the Department of Education here in the province to make sure that no learners are left behind in this process and that they are able to write their exams.
Now, we need to have a serious conversation about how we can mitigate the impact of future natural disasters, especially in disaster-prone areas. I mean, these floods are becoming more and more devastating, and government from local to national cannot afford to be found unprepared, whether in as far as emergency response is concerned or in as far as infrastructure is concerned. The Minister of Cooperative Governance and Traditional Affairs indicated that infrastructure, whether drainage, infrastructure, bridges, roads, all that need to be resilient to withstand such disasters.
As a country, we need to start a hard discussion and confront the real challenge of people living on the banks of rivers to be removed before the worst happened. We were so happy. We visited 4 centers where our communities are kept, and all of them, they nodded with their heads to say yes when we said people on floodplains should be removed, because they saw themselves, their houses covered, and losing 57 people as of now at one time is very bad. And this should be a discussion now countrywide. All 3 spheres of government, local, provincial, and national, all political parties, civil society.
Now, infrastructure needs to be resilient to such climate risks. Future constructions must have also extreme weather events in mind. Even approvals of new developments should no longer be based on what could be the worst floods in 100 years, but 50 years. And the question we're asking you tonight is, what do you think needs to be done to strengthen the planning systems so the extreme impact is mitigated from such disasters? And if you live in areas that are disaster prone, do you have solid infrastructure? Has government invested in emergency response or in maintaining that infrastructure? Or do you have dangerous low-lying bridges, drainage systems that are not on par? What's your experience? We need an improved disaster management strategy. Please share your thoughts with us. You can send us a WhatsApp voice note on 078-459-1897. Remember to tell us your name and your surname and where you're sending that voice note from. Please keep it at 30 seconds. Alternatively, you can send us an X on @FaceTheNation SABC. All right, let's start this conversation with Dr. Elias Sithole, who is the National Head of the National Disaster Management Sector. Dr. Sithole, thank you for making time for us. Good evening. Dr. Sithole, I think you may be muted there.
Okay. Yes.
Perfect.
Good evening, and good evening to the viewers.
Thank you for making time for us. Let's start just with the extent of the impact of this disaster in as far as infrastructure is concerned.
Yeah. The impact of these disasters in the infrastructure across the country is huge. And it costs billions of rands in terms of the repairs. So what we've been saying to other colleagues from other sector departments is that we need to find a way to build back better if the infrastructure has been damaged, but also adopt new technology so that whatever we're experiencing, and then it can withstand the impact of any disasters.
And Dr. Sithole, these floods and other disasters that we've seen in other parts of the country, suppose they indicate how prepared we need to be for more extreme weather events. From your assessment so far, was the Eastern Cape government prepared for an emergency like this in as far as response management is concerned?
Yeah, Eastern Cape is one of the provinces which is well prepared. When I said well prepared, they have most of the municipalities, they have established what we called disaster management centers. And in the Eastern Cape, the provincial government, led by the MEC here, they have established the provincial advisory forums where all the stakeholders participate. When you also go to the municipality, the municipalities also, they've established the advisory forum where all the stakeholders, they participate and advise each other in terms of how best they can actually manage disasters. They've also drafted disaster management plans as per legislation. So there is a foundation in terms of how best they can respond to disasters.
And when you look at, for instance, the drainage infrastructure, maybe even the bridges, because that's what we saw with that taxi that was swept away by the water. I mean, the bridges and other forms of infrastructure, has that been properly maintained? How prepared, and even the level of investment that needs to be done on that? What's been the advice and the assessment?
Look, countrywide, we still need to invest in terms of building high bridges, because you tend to find that when you go to, let's say, a village, a road connecting a village to the town, it tend to have a low-lying bridge. And that low-lying bridge, it was built maybe donkeys of years ago. Now, over time, with the impact of climate change, we've seen the impact of the floods. So that bridge can no longer withstand the volume of water, or sometimes the amount of rains which we normally receive in those areas. As a result, you tend to find most of those low-lying bridges that tend to be flooded. So there is some kind of investment which we still to make to some of the areas to improve the bridges, but also the quality of the roads.
Yeah. One of the concerns that have been raised even by the Minister of COGTA is that there are people who are in these floodplains. They are in these areas that are not suitable, and perhaps that's an important conversation that needs to be heard. And I don't know how you even begin to tell people, especially in a situation like this, that they need to start moving away from those areas. But what's the plan from a national strategy point of view to deal with that? Because there are lots of homes that are built on land that's not suitable. And when the disasters like this strike, those are the people that get affected the most.
Yeah, you see, it differs from province to province. In other provinces, you realize, or you tend to find that maybe it's a problem of the available land where they can build their houses, and they find themselves closer to the riverbanks. In other provinces, is a problem of the informal settlement, and most of the people they stay in those areas because they want to be closer to the work environment. So you are correct. We need actually to have got a deep conversation with the communities, but also do those awareness campaigns so that people, they understand that staying next to the riverbanks, you might actually lose your life. But also we need to bring the traditional leaderships, we need to bring the community structures so that all of us work together in terms of advising the communities so that they don't build next to the riverbanks, so that we avoid these incidences which we are normally experiencing during summer season. So definitely there's still a long way to go, but we have already started in terms of coming up with the mechanism of a disaster risk reduction. Through those planning task teams, we'll be able then to extend the work of government and then reach out to those communities. But of course, because some people, they've built bigger houses, it's not easy just to relocate to another environment. So it's more like the whole of government working together so that we are able to assist those affected communities.
There are some parties that are now calling for a declaration of a national state of disaster. Is that being considered? I know you've done a classification of the state of disaster, which my understanding is that it has all the elements to allow for the intervention of all three spheres of government. But is that a consideration? Because I know also when you declare that may take a bit of time.
Yes, today we have classified the state of disaster, and the classifications, it allows the provincial sector departments and the national departments to reprioritize their budget so that they're able to assist the affected communities. But also it allows different departments to activate their contingencies so that also they're able to assist the affected communities. So the classification in this case, because we have assess the situation in KZN, we got reports from other provinces as well. We are here today. We've been here, my team have been here in the past 2 days. We've assessed the environment, and we came to the determination to say the classification would be sufficient, because we don't need to put regulation for now, but we need resources so that we are able to deal with issues which are affecting the communities.
Is the province, from your assessment, capable of delivering this much needed humanitarian aid, even the infrastructure repairs and the relocation planning, or that needs to be spearheaded by national government?
No, the province, it is capable to spearhead any development which need to happen in the province, of course supported by national government in terms of the funding and some of the support, because the three spheres of government, in any way, we work very close to each other. So we will support the provincial government of the Eastern Cape to spearhead the development and the reconstruction. But as national government, we definitely come in and augment some of their capacity, either in the form of the finances. We have disaster grants, which we could always assist the provincial government. And then as and when we identify the gaps, some of the national government's departments will come on board and then close those gaps, and then we assist the provincial government.
Yeah. Are we investing enough, though, in just the preventative measures? Because, I mean, we can't surely be a reactionary government when we've got disasters like this, and then we start thinking about, okay, this is the investment we need to make. These bridges that are in low-lying areas, they need to be refurbished. What's the plan from government side? Because we know of the areas that are disaster prone, and we're seeing more and more of these events are producing the most devastating of impacts. What investment is being made so that government is not reactionary, but we plan way in advance and we become more preventative in our approach?
Yeah, there's a lot of investment currently which we are doing. For example, we are now introducing the early warning for all, meaning we want to make sure that when we distribute early warnings, everybody actually received early warning in South Africa. Even if someone who doesn't have a television, that person will be able to receive the early warnings. Two, we want to make sure that as we build the infrastructure, we build the better infrastructure, adopting the new technology in terms of rebuilding of that kind of infrastructure. There's a lot of effort which we are bringing in with other partners as well in terms of advice. As and when municipalities are implementing the IDPs and we are rolling out some of the development plans, these thinkings are already finding expression to those documents, to those plans rather, so that as they're implementing these plans, we know that we are then implementing sustainable projects moving forward. Of course, we might not have all the monies, but we do believe that if we bring all the resources together, coming from all the angles, we'll be able to move from one step to the next. At least there will be progress. Yeah,
and of course, money ends up being spent anyway when these disasters strike. There's money that must be reprioritized. Government then starts thinking about more investment. So maybe that needs to happen before these disasters strike. Thank you for making time for us. I really appreciate it. Dr. Elias Sithole is the head of the National Disaster Management Center. Let's bring in Zolile Williams now, who is the MEC of Kokta in the Eastern Cape. MEC, thank you so much for also joining this conversation. Good evening.
Good evening, Clement, and good evening to the viewers of the program.
So I suppose the big and bold step will be to try and start engaging and persuading people to move away from these floodplains. What is the plan? Because except for the children, most of the fatalities were reported on floodplains, and this is a ticking time bomb.
Definitely, Clement, but let me hasten to join you and on behalf of the provincial government, send our message of condolences to all the grieving families during this difficult time. Indeed, as a province, we need prayers because of this unprecedented tragedy. And in trying to respond to your question, I would want to indicate that since 2022, Clement, we have adopted as the provincial cabinet a disaster risk strategy which maps out in all municipalities, rural and urban, all the areas that have construction that are below the flood line. And since then, we have issued clear instructions to municipalities to remove those communities in areas that are below the flood line. But the difficulty, Clement, has been such that those communities have rejected moving away from those areas to the extent of taking municipalities to court, such that there's a tussle between government and those communities to move away from those. And now there's consequences of that is such unprecedented circumstances that we're facing today.
Mm. Many of your municipalities in the province are rural and cash-strapped with hardly any ratepayers. So how do they then prioritize infrastructure that can help in such instances, like, for instance, adequate drainage systems when they barely have enough to survive?
Look, we are deploying municipal infrastructure grants to all the 39 municipalities of the province. And such grants are being spent to exactly attend to the infrastructure. But sometimes I must be clear that the issue of failure to maintain drainage systems contributes to localized disasters. This is why we have developed a strategy where we are implementing non-negotiables to force municipalities to maintain infrastructure so that it is capable of preventing disasters or localized disasters.
Mm. Is that investment enough though, MEC? Those municipal infrastructure grants, as I say, when the money goes there, some of the municipalities, because they are so cash-strapped, that's not where they think that's where they should be using the money. So how intentional are you going to be, particularly as a provincial government, being a disaster-prone province, to be intentional about these preventative measures so that we at least mitigate against the most devastating effects of such disasters?
Well, there's a current review of the white paper on local government. And that process is helping to relook and analyze as to how municipalities are funded in the whole of the nation. The challenge we are facing, Clement, is that the current formula indicates that the population of the municipality is the one that is being used to determine the allocation of finances. Some of our municipalities, they are able to deliver services wall to wall, but the population is not so large that they would get sufficient infrastructure grant. Now, the review of the local government white paper is to assist those municipalities. So as a province, we are deeply engaged with that process with the national government in order to ensure that such municipalities get properly funded, because those wall-to-wall municipalities should get sufficient funding in order to attend to both extending new services to those needy communities because of backlogs, and also their capability to invest in maintenance of that infrastructure so that it is able to deliver efficient services. Yeah. So that's a big debate that we're currently engaging on.
Yeah, and lastly, MEC, and I think it's said that this is often the question I ask the ministers and MEC every time there's a disaster and there are funds that have to be reprioritized. Are there protective measures in place to ensure that the money that's going to be reprioritized or allocated for this disaster is going to go exactly where it's intended to go, and they are not going to be people who just want to get their hands in the cookie jar?
The good thing we have in the province is the adoption of a risk-adjusted strategy, which looks at the value chain of the whole infrastructure system, from procurement, from planning to procurement, and actually looking at the value created after projects have been constructed. So it will be difficult because we watch that process like a hawk. I sit and with all municipalities every quarter, analyze the expenditure patterns, analyze supply chain processes, and from there on, our officials and engineers visit the site to actually evaluate the value that is created in order to ensure that value for money is sufficiently looked into in delivering this project. But I must just indicate that so far, all the needy people around Sabata Dalindyebo municipalities have been attended to, such that we are now delivering about 1,000 mattresses from the provincial government and all the service providers that support our initiatives. Food, Department of Health is also involved in ensuring that those communities, they are served through mobile clinics. Roads infrastructure is being attended to. Those bridges that are low-lying, especially in rural areas, they are being attended. And kids from schools, as the education minister has indicated, we're trying to ensure that those schools are clean so that kids can be back at school and their exams can be written later in June. And we are trying our best to ensure that those that are affected are comforted. And the last thing I would say is that we're also having a team that has been appointed by our Director General to look into the funerals that will be happening, because government is going to support all those communities.
Yeah.
So we're going to look at truncating dates, negotiating with those families so that those families are comforted during this difficult time.
Okay, but to be clear, MEC, because you also mentioned funerals there's a lot of money that's going to be moving in between the departments and out of government. I hope we're not going to have you back on the show where we talk about monies that were misdirected, that were initially intended to benefit the people that have been affected here. And I know it's probably wild that we're talking about this, but if history is anything to go by, especially even in the Eastern Cape, you know about what happened during the funeral of the former President Nelson Mandela. So do you guarantee the people, especially of the Eastern Cape, that the monies that are intended for this disaster relief are going to go exactly there and nowhere else?
Look, the Nelson Mandela funeral scandal is something that we would want not to even think about, because of how it damaged the name of our revolutionary icon. Now, I want to confirm to you, Clement, that this provincial government has got more than 13 departments and state entities with clean audits. And I'm saying we have moved away from that past towards clean governance, and we will ensure that everything that happens in relation to the funeral is done to the T, and our officials know our stance that if you move out of the line we've given, you will be dealt with harshly. I think everybody knows how our stance is of a clean government. We've moved away from the past, and that issue is now gone in the Eastern Cape.
All right. So Lile Williams, the Minister of MEC of Cogta in the Eastern Cape, thank you for making time for us. All right. That question we've been asking you tonight as we focus on this tragedy that's befallen the Eastern Cape. What do you think needs to be done to enhance disaster preparedness and reduce the severity of its impact. On Twitter, Kolile says, build more capacity in rural towns as a matter of high urgency, provide more infrastructure and resources so that they are able to respond and exchange skills and knowledge, especially from those big metros which have huge capacity. Wandile says our community should not trust politicians who always encourage them to grab the land, and municipalities must enforce their bylaws so as to avert these disasters, and the buildings are built on the unsustainable areas. Leaders should also shoulder the blame. Sehwate says what has just happened in the Eastern Cape is devastating. The main thing is proper infrastructure. Bridges have to be high enough on the main roads. We must also normalize not to settle at the floodplains. Deepest condolences. Michael says we need to localize disaster plans, fund early warning systems, and empower communities with education and resources. Poor and working class areas must be prioritized. Disasters don't discriminate, but inequality makes them deadlier. Thank you very much for your comments there on Twitter. We'll be back after the break. Welcome back. Minister of Health, Dr. Aaron Motsoaledi, has assured South Africans that the current COVID-19 variant reported to be circulating in several countries, about 22 of them, is not a cause for concern. The new variant is reported to have been detected in India, Europe, and the US. There's Australia, and in some parts of Asia. For more on this, we're joined by the Minister, who is joining us now in studio. Minister, thank you for making time for us. Good evening.
Good evening, Clement. Good evening to the viewers and listeners.
Yeah, let's start maybe with what we focus on the show a lot today, this tragedy that's befallen the Eastern Cape. I understand that you will be heading there as well tomorrow morning.
Yes, very early in the morning. I must be there because the President is visiting Eastern Cape. A number of my colleagues, ministers, are already there. I'll be joining them tomorrow, yes.
Mm-hmm. And what becomes your role there?
Well, obviously, health services are needed and they might be overstretched. For those who have survived and need, there are people there with hypothermia and all that, we must make sure that we are able to treat them and keep them comfortable. But also, because those who passed away, it's not a natural death. We don't regard this as natural death. When you die of injuries like that or drowning, they all need to have post-mortems done. And it's my department that is responsible for that.
Yeah. Let's now speak about this new COVID-19 variant. It's being monitored, no resurgence of cases the last time you updated us. Is that still the case, or are there any concerns?
No, it is being monitored by both the World Health Organization from Geneva. Remember, for us to start worrying is when they declared it's a public health emergency of international concern, or fake, like they did in 2019. There was COVID in Wuhan in China, but they were monitoring it. And until they declared it a public health emergency of international concern, it's then that you realize it's going to affect the whole world. Mm-hmm. So that is happening. But also here in South Africa, we've got the NICD, the National Institute of Communicable Diseases. They monitor all these respiratory viruses, especially in winter. Remember, it's winter now. We are going to be getting influenza. They must know what strain and, whether they must encourage us to vaccinate certain people who are vulnerable, etc., etc. So even the NICD is monitoring this particular one. Mm-hmm. And up to so far, they haven't picked up anything. I've seen on social media doctors and experts.
Yeah, because some people have been concerned about the seasonal increase in influenza, and they beginning to think, oh, the minister spoke about a COVID-19 variant. Suddenly so many people we know have got this flu.
I spoke of it specifically because it was already on social media. They were already scaring people. And now I took advantage of addressing the G20 Health Working Group. The health working group on G20 on Tuesday. I even told journalists that I was not addressing, those people come from all over the world. Many of them are health experts anyway. They know and understand these things. So I told the media, I'm taking this opportunity to address you in order to inform South Africans, because there's already some form of panic and all that. So that's what I was doing. I was trying to clarify.
Yeah.
But I realized, as sometimes it happens in the media, I said, the NICT said, there is nothing that needs to be done for now. There are no health measures except the normal hygiene measures which people must take at all times. What are normal hygiene measures? Washing your hands all the time. You don't have to wait for COVID. Covering your cough when you cough. If you feel like you have got flu, stay at home. If you have to go out, put on a mask so that you don't spread flu all over. Then when I said so, people said, oh, it means there must be some COVID, because they only learned about masks during COVID. Whereas if you remember, during COVID, when people were putting masks, even this influenza, the normal influenza that usually affects us in winter, it was not there, because people have covered themselves. So all we're saying is, for now, because it's winter, use the ordinary, normal health measures. Don't stop of washing your hand, covering your cough, etc. You stop many respiratory illnesses. It's not because we're doing so because there's COVID. No, we haven't seen any figures of COVID going up. Okay. No.
The pandemic agreement that was reached at the B20, how does that affect us?
It's not. It was at the World Health Assembly.
Yes.
The pandemic agreement, not B20. It's World Health. World Health Assembly is an annual gathering of all ministers of health and all international health organizations and experts. They meet in Geneva every year in May, under the auspices of the World Health Organization. And this was the 78th time. Remember, the World Organization started in 1948. This was the 78th version. Now, the difference between this one and the other ones, Clement, is because after COVID, or rather, you remember during COVID what problems we have about hoarding of vaccines, this country being the one that has got masks and needles, and that one not having, especially in Africa, there were big problems, you remember that. Even the pricing, you know, and all that. So after that, the World Health Organization said, we should not wait until we have got another crisis. We must have a signed agreement called pandemic preparedness. What happens during the next pandemic? So they put up a team called International Negotiating Body, IGB. Coincidentally, it was chaired by South Africa and France. In South Africa, we sent our former DG for health, Professor Precious Matsoso. France sent their ambassador of international health. They sat together with the teams from all over the world. And they spent 3 years. It happened immediately after COVID, 3 years, negotiating. What were they negotiating? They were negotiating the terms of behavior of countries, whether rich or poor. What happens when there's a pandemic, who gets what? That's what they call pandemic preparedness. The central piece of that is something called PAPS, meaning pathogen access and benefit options, and benefit, services. What it means is, in the past, you get, because most of the infections happen on the African continent, you get these big countries with lots of scientists around the world. They come to that country, they get that pathogen, that germ that is causing the disease. Because they've got facilities and resources, they study it and analyze it, out of which comes a cure, or even a vaccine, or some form of treatment. But that original country that help with the pathogen, they usually get nothing. Or they are the last in the queue. But what has been studied, what led to the discovery of this medicine, came from them. So they said there must be some form of pathogen access and benefit option, whereby the person who accessed this pathogen, which led them, helped them to produce a medicine, the person who gave that pathogen must gain something. And the proposal is that 20% of the proceeds of that pharmaceutical company must be donated to the World Health Organization whereby the Wealth Organization takes 10%, and the other 10%, 10% to help other poor countries, but the other 10% must be due to the country where this pathogen was found. Now, that one is still need an annexure of details. You realize that is about business and all that, of details, and it will be adopted next year in the next World Health Assembly. Okay. You had announced a few months ago that there has been an approval of the creation of about 1,650 new healthcare positions. I think 1.3 billion rand was allocated even for hospital equipment as well. At the time, you said that was in line with the new budget presented by the finance minister, but that was like what, budget number 2, I think, if I'm not mistaken. We now have budget number 3.
How budget number 1?
Was that one number 1?
Yes.
Yeah, we're now on number 3.
Yes.
How is these plans going? Are they affected at all?
I forgot them. Budget number 1, remember, never happened.
Yeah, it never really took off.
Budget 1 never took off.
2.
So it was budget 2, you are right, I'm sorry.
How
it was budget 2. Remember, in budget 2, they were saying health and education has suffered austerity. The reason that public health care is in this state in which it is, because for the past 10 years, there was austerity, meaning budget cut. So they said both health and education, we need to move them out of austerity. And they said they are giving us 29 billion rand over the next 3 years.
Yes.
That was translating to 9 billion per year for 3 years. That is budget 1. But in budget 2, that was cut to 20 billion, translating to 6.7 billion every year for the next 3 years. That is what we are working on. That's what we are working on.
So, but we are operating on budget 3 now?
Yes.
Yeah. So
budget 3.
So it doesn't affect the plans that you've announced on the 1,650 new healthcare positions and this money for hospital equipment?
No, we said 1,300. Yeah, it's 1,200 doctors, 200 nurses, and 250 years. No, your figure is right. No, it did not affect it because, fortunately, when I called the press conference, having met with MECs at the National Health Council, when I made the announcement, I phoned the Minister of Finance first. I didn't just make an announcement. And he said the way things are, because they were preparing budget 3, he said the way things are, you are unlikely to get the 9 billion we've initially announced. It's likely to be somewhere half of that. So work around that. So we had already worked around that half. If it didn't happen, we're going to get more. But now that that budget cut happened, we are still where we announced, because it was based on a suspicion that there might be a cut because remember, the whole question of VAT was not being accepted.
Okay, no, that's good to know, because I mean, these are doctors, many of them that have been waiting for jobs, and we need this kind of equipment in hospitals.
No, we are going to.
Yeah,
we have already. We are just waiting for this process. Like yesterday, it was adopted. Once this parliamentary process are over, we advertise 1,200 jobs for doctors, 200 for nurses, 250 for other health personnel. We buy 1.4 million articles. That consists of beds and bassinets and mattresses and sheets and all that. They will cost us 1.3 billion. So we are still on course to do that.
Minister, thank you so much for making time for us.
Thank you very much.
We'll be back after the break. Welcome back. So the question we've been asking you tonight is what you think needs to be done to enhance just the preparedness of our communities and even our provinces, especially areas that are disaster prone, to avoid the severity of the impact of these disasters. Your tweets, Dennis says, by implementing effective early warning systems that can really help alert communities of potential disasters, allowing for timely evacuations and preparations. Rabotata says the poor people are most affected by disasters such as floods that took lives in the Eastern Cape. The government must ensure that people are removed from flood-prone areas, afford the poor
also with proper infrastructure. We also have some of your WhatsApp voice notes that have come through responding to what's happening in the Eastern Cape. The conversation we really need to have going forward is how we implement preventative measures so that our government doesn't just become reactionary, but there's a plan in place to prevent further disasters, especially these devastating impacts. Here's what some of you have said on the voice note line.
Wetlands.
Right, apologies with that technical glitch there. Well, in the meantime, and maybe we'll come back to those WhatsApp voice notes. Let's look at this now. The first group of the South African National Defence Force troops is set to return from their DRC deployment tomorrow. The troops have been deployed as part of the Southern African Development Community Mission in the DRC. The soldiers are expected to arrive at the Air Force Base in Bloemfontein. SANDF official Rear Admiral Prince Chabalala joins us now from Bloemfontein. Thank you so much for making time for us, Mr. Chabalala. Good evening.
Good evening, Clement.
How many soldiers are part of the first group that's touching down tomorrow, and when are the remaining soldiers coming home?
Look, Clement, on behalf of the South African National Defence Force, we'd like to say that the return of our troops which were deployed under the SADC Summit DRC mission will come in phases. The first group is coming tomorrow. We are expecting approximately more than 250 soldiers who will be landing at the Breg Air Force Base.
And then
afterwards, there will be a number of sorties that we take as they will be flying from Tanzania, and they will come up in that staggered approach. Sometimes the number will double to almost 500 with various flights. But we aim to have completed this operation by the end of the month.
Yeah. Is there a particular reason that this mission is happening in phases?
Yes. Remember, we do this in a phase approach because the repatriation of our forces itself is a standard military protocol that is necessary to ensure operational security at the rear, and also to maintain the readiness in the area of deployment and allow for orderly disengagement. Also, a phased approach also allows us to conduct detailed medical demobilization process, which involves medical checks, psychological support sessions, and structured reintegration for each returning group. Hence, the phased approach is important.
Yeah, this withdrawal seems to have proven to be logistically challenging. My understanding is that there were overland movements through, was it Rwanda and Tanzania, before the troops could then return to South Africa by air and equipment by sea. Just help us understand these logistical challenges and what they were brought about.
Look, the phased withdrawal is a very challenging aspect of operation because you'll have to have a sufficient logistical support such as air, and with your infrastructure also moving in various conditions. Sometimes the terrain is very complex, and some equipment are very sensitive and very heavy. And therefore, you have to really plan it as an operation within the operation on its own, so that you are able to complete the mission. You don't leave out anything, and also bear in mind that there's also security conditions that you need to be guarding against. So this is a very sensitive, yet you have to take consideration in terms of a difficult terrain. And sometimes the infrastructure itself is limited because you have to take troops in a certain kind of aircraft and also take equipment in a certain ways, such as the heavy equipment, as we already explained, that some will be being transported via the sea, and then some likewise will have to be flown back home, and the personnel also have to be flown back home.
Yeah.
So logistically, it's an operation within an operation itself.
Yeah. So out of the soldiers that were deployed initially on this mission, how many soldiers now in total have we lost? Is that number still at, was it 14? And how many have been injured since the deployment? Do we have those numbers?
The numbers, as we haven't lost anyone except for the 14 which we had already announced to the public, and we had honored them accordingly. And the injured were repatriated first after we repatriated the bodies. I'm sure you will recall that. And everybody has been accounted for. Now we are just dealing with the main personnel, which, as I indicated, approximately more than 200 will be arriving tomorrow, so that we are able to carry on with our operation. Then there will be another sortie, meaning they will be traveling from Tanzania so that they can land on time here at home.
All right. Rear Admiral Prince Chabalala, thank you so much for making time for us.
Thank you very much, Clement. Thanks.
All right, let's try that again now and wrap up the show with some of the WhatsApp voice notes that have come through responding to the question we've been asking tonight about that devastating situation in the Eastern Cape and what needs to be done to prevent such disasters from being really impacting people the way that they do.
Sam Alakotrikopis Clement Dumela. Careful planning, early warning systems, wetlands protection and restoration, investments in infrastructure, awareness raising and education, and lowering greenhouse gas emissions can reduce disaster risk. Bye-bye.
Answering the question, I think government should develop plans to rebuild and upgrade critical infrastructure, incorporating disaster-resilient designs and materials, provide ongoing support to affected communities, including counseling, economic assistance, and social service. Long-term recovery efforts should focus on rebuilding resilient infrastructure and enhancing disaster preparedness capability.
Thank you so much for your comments, and thanks for watching the Thursday edition of Face the Nation. We'll be back with you on Tuesday next week at 8 p.m. Have a good evening. Cheers.